You are listening to the Partner Up podcast by Welcome to Bundaberg. And in this series, you will hear from community leaders who are kicking big collaborative working together goals. We will highlight the successful partnerships, shedding light on the positive impact they have had on both businesses and the community. Welcome to Bundaberg aims to improve the health and well-being, work and lifestyle outcomes for people living in Bundaberg by activating and implementing a range of community-led strategies across a range of services for a more connected, cohesive community. Before we start today's episode, I would like to acknowledge country. I would like us to take a moment to reflect on the meaning of place and connection. In the spirit of reconciliation, I wish to acknowledge the traditional custodians of the lands on which we live, work and love on. I pay my respects to elders past, present and emerging of all the lands, and I extend that respect to all First Nations peoples listening today. Let's go. Today we're talking to Dr. Hazel Dalton, all the way from Orange. Welcome to Bundaberg. Thank you for joining us here. So I've been lucky enough to work with Hazel over the last, maybe 3 or 4 months. We've been working together on a different project in Bundaberg, but today I have you here talking about integrated care and integration models and place-based activation, I suppose, which is something that Wide Bay Kids and Welcome to Bundaberg is always looking for solutions that are evidence-based and coming from a place of authenticity, and that genuinely are wanting to help communities make change for a healthier, better community. And so I would love for you to introduce yourself and the work that you've been deeply involved in, the research around rural health and integration and place-based work. Tell us how you kind of even led into that, I suppose, for listeners who may not have heard your background.
Thanks, Gail. So my foray into health services research came with a move to the country. So I'd been quite a long time, over a decade, in biomedical research and discovery science, so experimenting on benches and things like that. And we moved up to the country, and Orange is a lovely regional community with a substantial hospital and health service and a university, and I figured there'd be something there for me, and there was quite a lot more than I realised. And I started out working in a rural clinical school and just really seeing the challenges that rural communities face, like the workforce challenges, we just have poor outcomes and an inequitable split on funding and resourcing, and we have more challenge. You've got greater distances and things like that. So my second role in Orange, my second job was working with the Centre for Rural and Remote Mental Health, and I moved into that space, and from there I grew an interest in integrated care. So as a biologist first, finding the distinction around mental health and the siloing between that and physical health was really problematic, because the human body is a system and those things aren't really all that separate. So, there was that curiosity side and also this equitable side. So, and in mental health, it's actually exacerbated because we underfund for mental health relative to the burden of disease. So in general, we're not budgeting enough, and then we're really often not spending that budget. And so what happens is people are really underserved, and that comes out in the outcomes. And for rural, it's less than the city. So there's a lot of fairness in it. So a lot of my work is really about highlighting that. But it's also finding the models that work and actually do address the challenges. So I don't know where to take you from there. We can go through some examples or other things.
Well, we'll get into some of those examples, I think, and I'll frame it in a way. The last few days we've been spending at the Nest in Bundaberg, which is a new child and family hub focused on really connection and integration, and it's really about not just a co-locating space where services work out of, but a place where services can integrate the way that they centre and circle around a family and how they support that family. And I know that some of your research papers have a focus on, you know, it's not just about co-locating in one building, but it's actually about how people work together. Can you unpack some of that and what real integration looks like on the ground, the good and the bad? Because I think if we can learn from some of those lessons of when things haven't quite gone right, they're our biggest lessons and learnings.
Excellent, for sure. So something around, I guess, in terms of principles of integrated care, it's about being more person-centred or child and family-centred, depending on what you're looking at. And if we think about health, accessing care and getting the right kind of care is also part of that framing. And so if your services can be more integrated, more connected and more knowledgeable about what each other does, you're actually probably likely to be able to serve someone better. I think the other thing that comes into play is it's not just health and clinical services that we think about, but rather, especially generally, into social care and the determinants of health. And when that comes around to children and young people, that feeds into education as well. So there's that kind of, if you think differently about the touch points of people's lives, I guess I came into it thinking about, you know, what are the times in your life where you really need that, where you will be accessing care and you should, you know, that they're the opportunities for really developing good health promotion, good health access behaviours and all of those things. So motherhood and that early years is incredibly important. And then the schooling opportunity as another one, as a touch point. Because as adults, we can just kind of go for a long time, if we are lucky, really not touching the health service. And so there's that thinking about how do we make the most of those opportunities and actually make sure that someone's off on a right trajectory and things like that. So that's the general sort of principles of those things. I've had the good fortune of working with collaborators from the International Foundation for Integrated Care. We started an Australian chapter back in 2016, and got to work with the Central Coast Local Health District, who had one of the $20 million, I think a multi-million-dollar investment in integrated care, and they were able to run, they had 3 different streams of population and an enablers program. One of the streams was children and families, vulnerable youth, and there was a really interesting project there where they had, speaking of touch points and how we take care of those who might not be realising how serious or where they could get help, there was an early referral service from schools. So actually this is a social, it's in New South Wales, this is funded from social care, so the Department of Social Services. They have a family referral service where if you need help, they're there to help you. But if you're a government department and you hold a carrot and a stick, people can be quite reticent. And even though they divested that to an NGO, a big review of it found that it was a really good program, but they really weren't getting the uptake that they needed. So we did this trial. I didn't do the trial, I got to evaluate it. There was a trial in schools in the Central Coast, and they had an incredible team who put that together. So we had that whole integrated care program had support from the equivalent of the HHS and LHD. It had the primary health network, it had school, it had social services. So we had this top level support. We had this really activated project team and some good champions in some of the schools. And so what we ended up finding was that actually the program worked really well. So teachers could identify, you know, if a particular child wasn't doing well, and would suggest to the family if they wanted a connection to this referrer, and they could come in and help. And I guess what we found was some families just needed information, some family needed a brokerage, some families needed a long time going. We also found that sometimes the problem's not the child, something's not going well with the parents, but because this was an integrated care model and their remit was to connect to health and social care, they were at liberty to make those things, including let's connect you with a GP so that we can get the paediatrician referral, so that we can also manage you while you're waiting. And so what we were able to see was this great variance in connection and time, but I wrote it up saying this is appropriate because that's actually what the model's supposed to do. And there was only a few really big outliers where there were long contacts, and I think they may have been kids who really needed some support and had been languishing and that kind of thing. But I guess what I was really impressed about that was that it was genuinely person and child and family centred, and you think these things are possible and it's not expensive. You know, this is an NGO, this was about good support all around, and the difficulty then becomes who funds it and who feels responsibility for it. So one of the challenges with that was it was funded from New South Wales Health Funding, and from their perspective, this is a significant investment in long-term trajectory where their health should be better in the long term. But in budget runs, that's not now. The people who were feeling the dividends were education. And so, you know, there's sometimes this tension around people need a win now, and it's how do we make sure that we get funding in the right pocket so that you can sustain things.
Yeah, that's so true. When I was reading some of your papers around this particular topic, you often talked about collaboration and the time it takes and the trust that it takes and the leadership that it takes.
Most definitely.
Yeah. Talk us through why those things are so critical in this space, and how that really joins everything together.
Yeah. I think the thing about for collaboration to work, especially when we're all working off different pots of money and we've all got different KPIs, and when things get a little tense, you can be constricted. You need to work to find a shared vision and be able to sort of identify how everybody's winning from the thing that you're trying to work towards, and be clear on that. And don't be genuine about it. Like, actually work through and say, how can we make sure that everyone can be as well represented as possible if you're at the table, and what do you need? And then you need those leaders to champion it. You need those leaders to work down the layers of leadership as well, because you can have, I think when I was there with the Central Coast one, there was like this at the departmental level, top level support. There was, then the operational team were great, we knew it was working, but when there was mid-level oversight changes, that really affected the commitment and the stability. Plus, there wasn't a promise of more money. So as soon as there was a looming deadline, the retreat comes in, and it really did take a lot of drive. If you want things to go through, it does take persistence. And I think some things that they did really well, which really saw them through to a lot of good things, was they called in expertise early. So I can track some of that back. There was an integrated care conference in 2014 where lots of people were brought in, and there was enthusiasm, there was reach. And then the team from Central Coast had reached out to us earlier around training. We'd been over there, and we'd brought experts from overseas to talk through things and on leadership. And they were able to already do some of those conversations, which is co-location is great, but it doesn't mean collaboration. You have to foster things. And there is, it takes time. And I think one of the things that's challenging is if your organisation is obsessed with efficiency and they want things to run as lean as possible, you can discount like what time it takes to go meet with others, to build relationships, to understand what the others are doing. And there's this sort of communication overhead of person time that's needed to be in each other's business and to respect and understand what that is. And if you don't allow for it because you run people so hard on what their day jobs are, you actually eliminate their possibility to be a mature player in these complex environments. You're not really doing, your part needs to sit within a wider framework.
Absolutely. And I think to be able to do that, and you talk about this, I think, in some of your papers, it's highlighted that power and influence.
Definitely.
At those different levels and within those different systems. In the work that you've done, what do you see and how do you balance that power, or as your experience has been when that power has been imbalanced, and what are the challenges or the outcomes of that that you've seen?
I think it's really important, And I think there are things you can do. I can think about a community wellbeing initiative we were working with, and we were coming up to present our findings to that community and helping them collaboratively plan their response, so co-design what they wanted to do. And we were warned ahead of time that the collaborative group that we were working with, there was, you know, some people there who were enthusiastic and were the louder voices in the room, and there'd be some who were reticent. And it was just like saying, just so you know, you're going to have to manage this. Think about how that will be. Otherwise, you'll only get a certain flavour of what's going on. And I myself, I'm not great in the moment, and I don't always have all the good ideas right then. And so what we did was we used a tool called Menti, which was new at the time, but I think it's Slido, these sort of online tools where you can vote in situ and you can hold back the responses anonymously and then bring them back to the group and then have the conversations. And so you can sort of slow down that process. You can hold, you can gather voices, and you can do it. The other thing is also, so that was really important, and I knew we'd won because after the lunch someone came back saying, had told the coordinator, going, thank you, I felt heard, that was brilliant. And so there was that capture. And then there's the thing of rounding out and allowing people to get in touch with you later so you can bring information. I think the other thing, sorry, I'm going to go off track, but let's see. The other thing that's important in those spaces, you know, when we're working with community and trying to do collaborative things, I think the other thing that you want to do is you don't want to fool yourselves. So we've done things like where we do community-based reports. You pull the data from community, you bring together those metrics, and generally speaking, I don't think I had an exception yet. The community knows what's going on in their community, but seeing it in numbers and seeing what is good, not just what's wrong, is really empowering, and people can grip onto it and they say, yeah, and then you're able to go forward with plans because you have numbers, you have stories, you feel connected to it, and then suddenly you're in a different place of, well, what are we doing about it? And then you can also say, well, what does the evidence suggest about what we should do about it? You know, because sometimes our first solutions are already known to not work or have their own sets of problems. So I think there's that thing of owning what you want to do, but selectively court the experts, but don't be beholden to them. You know, if you know what I mean?
Yeah. I think one of the things that we've found here in Bundaberg, and I'm sure it's the same in other regional areas, are, you know, resources are often stretched. We're often already, you know, doing what we can with what we've got.
Totally.
And so any advice around how communities can build that secret, that sauce that holds the bolognese together, or that glue that holds us together, that unseen coordination and relationship really building without burning people out?
Yeah. I think some of it is you kind of have to find the others, and you need to be consistent. I think we need to find people like yourself who are connected, and, you know, by the nature of how you work and how you are, it's knowing the others, but not simply saying it, but actually bringing together a coalition. I think some of it is also about the advocacy and the consideration of how you want to move forward, because you are all really busy, but if you can make some changes, sometimes you can make gains such that it gives you breathing space. Like, you can look forward and go, that will make a difference, it's worth the push. So I think there are things around perseverance. I think there's things around knowing what the policies are, what the new sorts of funding are, and being able to say, we could do something with that. It's close enough, it's related, not making perfect the enemy of good enough. If you can survive on good enough, you can actually build your coalition, your capability, and you're going to stumble, you're going to have things go wrong, either by misfortune, people move town, you know, the thing that's funny about workforce and things like that is we live in families. Some of us don't get to stay where we want to because of work. Some of us, you know, for whatever reason. So you have to know that there's going to be those bumps in the road. But if you're clear on your intentions, you can survive a lot of what I would call implementation failure by keeping at it, but learning from what's not working. Mm-hmm. Like, don't just simply bash away and go, we'll get there. And being flexible and opportunistic. And I think there are lots of interesting places, both where you will find the people and where you'll find that sort of financial opportunity to say, how could we make this more sustainable? And when I think about the initiative, the Our Healthy Clarence initiative that we worked with, the first coordinator who was funded by little pots of money from everybody. So the PHN, the LHD, other organisations kicked in a bit, enough to cover her things. So this was self-done. She was a business entrepreneur. She was well connected with the community. She was fantastic. And it was that, and that was really then community owned. And actually what was interesting was when the Primary Health Network desperately wanted them to call it a suicide prevention network, they said, our direction of travel is Our Healthy Clarence, it's strengths framed, thanks but no thanks, it does the job, please fund it anyway. But that sort of, when you get to a point of ownership like that, I think that's when you really got some strength in moving on.
And that really comes back to that learning and adapting and that power and that balance and that leadership. Some of the conversations we've had and the papers that I've read talk about that learning health systems and how organisations can reflect and really take on that feedback through whether it's research or actually adapting what they're doing on the ground as they're doing it. Build the plane as they're flying, so to speak. How do you think Bundaberg, the network of services or the services that are currently using the NES could embed some of that learning culture? What does that actually look like?
I think some of it is about finding ways to track your shared history. Like say, if I think about the community wellbeing collaboratives that I've studied, one of the things that we worked out is if you're going to be community owned and transparent and authentic, some of it is about communicating frequently and openly with the community, and that's both stakeholders and whoever's listening. It's not about proof of who's doing it, but if you're keeping your records and you're sharing the things and you're documenting, what you're actually inadvertently doing is actually building an evaluatable network or initiative or whatever the thing you're doing. So it doesn't have to be terribly complex, but there's a sort of a thing of the consistency and of meeting at certain points, saying we're going to reflect on the last period of time, we're going to make notes, and we're going to say, how do we think this is going, and do things that you say, well, how do we really know that this is working? And it doesn't have to be fancy statistics or anything like that, but do people come to the events that you do? What's the flow on capturing some of those stories? And it's that kind of thing. And then people like me get very excited. Can I come and have a look at that? But I think you've got to take yourself beyond the shared recall of a story and do things to sort of capture and communicate. But I think it serves a dual purpose, because then you end up communicating effectively with those that you're seeking to serve, and you're actually building a story that might be measured and understood in the context. Such an important part of building that evidence of what's coming next.
And as we wrap up, I've got two more questions for you. But if you could give Bundaberg one piece of advice around the local leaders and the practitioners that we're working within this integrated care space, what would that piece of advice be?
The easy questions.
Just one piece of advice.
I think it's keep your purpose in mind. You're there to improve the health of your community, and wherever you sit, there are certain parts that you play, and don't get caught in the local, don't get too small-minded about it. There is a thing about how do you make sure that the winning looks like your collective win. I guess one of the things, sorry, this is long-winded, but there's a concept in integrated care where they talk about, it used to be the triple aim of care, and then it's the quadruple aim and the quintuple aim. But essentially what they say is you want to do best by the person in front of you, so good patient experience or service experience, but you also have a whole community that you serve, so you're balancing that, so the individual against the population, and you've only got so many resources, and that's both financial and human, that workforce, who you don't want to burn out. And you can't. So winning looks like all of those things in tension, So you got to focus on a couple of things at once, and that looks like good enough on a bunch of metrics, not winning on one. And I think that's where sometimes there's a tension. And if you've got organisations that kind of, pull against one, that's sometimes a risk. So
yeah, that's a really great piece of advice. Yeah, winning on one is not.
Yeah, you could be breaking other things.
Mm-hmm. And finally, I guess looking ahead for Bundaberg and the Nest, what could you see that it could shift, I suppose, in our community? And when you think of like a shift towards integrated care models, or what does that mean for a community-led approach?
I think for me, there's that opportunity, of place where someone comes to one place and gets wraparound support. That's very attractive, because what you then reinforce is a really positive experience for the child and family. You are able to, if that group is then in dialogue with each other, you're able to sort of say, I have someone, we connect you with, I think this would be appropriate, and you can have that collegiate thing, but there's a sense where you could really make an impact. And then you may have a more intensive interaction with someone at some point, but you might be reducing their future needs because things go better. So I think it's investing, in people's health and care trajectories.
That's wonderful. Thank you for joining me today. I really appreciate your time and your expertise. You've left me with some papers to read, which covers all these different topics, and you're a wealth of knowledge. If people would like to reach out to Hazel for some knowledge, or just to have a chat, how do they reach out to you?
So I'm Hazel Dalton. I'm a Senior Research Fellow at the Rural Health Research Institute at Charles Sturt University. You can find me on LinkedIn. You can find me on the CSU website. If you Google me, you should find me.
Thank you. I look forward to further discussions, because I think that we've got a lot to learn in this space, and you've already done a lot of work. So I'm looking forward to digging deeper into this and how we can take these approaches and models and methods in and really apply it to the Nest and elsewhere in our region. So thank you.